So SEARCH stands for Student Energy and Action for Regina Community Health, and we were an initiative started by a group of students that were really interested in getting some sort of community health program going in Regina. So they partnered with the universities as well as the Regina Campbell Health region at the time. For SEARCH, we offer social and medical programming. So every time we're open, we offer primary healthcare services from a nurse practitioner or physician. And then on our social side, we provide a free hot meal to everyone who comes through the door. We provide free drop-in counseling every day we're open as well as childcare and then a variety of different rotating programs such as cultural support, literacy days, fun with food cooking programs, and the list goes on. SEARCH is student run right from its heart.
Been here since last September, I think. But before that, I was a client for the past 5 years, in and around in the North Central. Have really, I guess, not really lost, but I don't know, just put aside their culture and for me being here, I think letting them know it's okay. It's okay to be Indian, it's okay to have your language. So with literacy, I bring in the Cree struggle, like how do you say words? Even just jewelry making, holding gloves today, just showing them the cultural aspect of it all. And for them to know that there is people out there like us that are willing to, teach them if they don't know, if they want to come back to.
What kind of services do you access here for yourself?
Well, like I said, a few times the doctor, I had ear infection once and the ear was plugged with wax. But I was depressed. I come because it was 4 years every Saturday I could, unless for some reason I'm not able to.
And it's not just the First Nations people come, there's non-First Nations people come, as you see. And they like to learn too, it's all around educational thing.
The professor recommended SEARCH because I was a little interested in med, doing a psychology major at the time, and thought, this seems like a good fit to get some exposure relevant to that. And a different part of town that I didn't really know what to expect, that I hadn't had a lot of exposure to, so it was a new experience, a little intimidating, but it was all very welcoming once I got in and got speaking to the people here.
The amount of learning that takes place is exponential. Students take what they learn and they take it back into their coursework and they take it beyond that into their future careers and are able to continue to share those stories and those experiences. And by doing that, we're creating a healthier Regina. Every day when we're able to break down any stereotype that might exist, any day that we can foster those relationships and developments and understand our patients for who they truly are and understand that whole being and everything that makes them healthy or unhealthy, we're better for it.
I did find that first coming in that you really had to build that trust, like that people were maybe a little bit wary and kind of like had to wait it out with you before you built a little bit of a connection. But I think just coming into it, even profession-wise, before I went back to school and went into nursing and came here, I actually did interior design, and that was my background for a long time. So I dealt with people that had money and were spending money and had this luxury in their life. And so I think coming from that and just the different professionals and everything I would have worked with, but sort of the way that their attitude was towards like I said, the materialistic things and everything that they placed a lot of importance on, and then coming into a community like this and working on it where you're like, okay, some people don't even have, appropriate food and don't have shelter that's safe and livable. So I don't know, it was just a very different from that background, and then coming into what I do now has just been very eye-opening for me.
it's a perspective that I don't get very much of right now in school, just being mostly in lectures and a few more academic physicians. That here, coming to Search, I'm a lot more informed on like some of the most vulnerable population in Regina and what's going on, and that dealing with raising numerous kids, dealing with mental health issues, dealing with addiction and trying to overcome those, and how it all comes from a very complex and like deep-rooted history in Saskatchewan, and how a lot of this population has been treated for a long time.
Over the kitchen, there's a sign. Over the kitchen. Kitchen's there, and way on over the cupboards. Yeah. And the sign says, "Love is the best ingredient," something like that. I'm impressed with. Not just the statement, but everything. The people, the foods. It's just a friendly place. It's respectful and friendly, and it seems very supportive.
It's just on my mind now, but what's with the bat?
I'm a fan of Batman. I like to go to the Fan Expo in Regina. I've been doing that a few years.
Do you think Bruce Wayne would be hanging out in these kind of places, or what?
It could be the very places that he'd be hanging out, where you have the people of lower socioeconomic status. And it's more simple when it's a fictional story and they can wrap it up in 30 minutes or 2 hours and everything's all good. But here it's lifelong, and the victories are much more inch by inch.
We love these kind of films, but in real life, if Bruce Wayne would have taken his money and like given it to primary healthcare places like this and secondary education, then the Joker may not have had many people to employ.
That's a really good point. That if you're doing all that preventative stuff, that it's not as like sexy overall as being like, we're getting naloxone out to all the EMS providers.
Bad guys' asses, but
we're stopping the trouble before it happens. We're making sure that these high-risk populations have the support that they need, so that there isn't any appeal in joining gangs or doing other more questionable activities.
I always tell them, if you are wanting to teach or work in a community, in a central community, you need to know, just the little cultural aspects of it.
Services like this are really important because the community relies on them for one, but it also allows and fills in some of those gaps that exist, especially in regards to achieving optimal health. Health simply is not just being able to go to the doctor when you're sick. It's about the social supports that you have. It's the food security that you experience. It's the environment that you're able to take part in, and beyond that. And so the more that we can have programs like this that can intervene at all those different areas, the more successful we can expect to be in terms of caring for individuals and creating a healthier society at large.